Hey guys, James Cobb here. Welcome back to Total Balance Chiropractic. This month being May, we have Spinal Awareness Week coming up. The topic for Spinal Awareness Week this year is Chiro Can Help. So we're going to be discussing some of the ways in which chiropractic care can help you get back on your feet, get more out of life. And this week we're going to be talking about an object that has become a bit more ubiquitous around the world in the last decade or so, and that is the humble mobile phone. So, is your phone becoming a pain in the neck? Well, stick around, because in a few minutes we'll be back to discuss some ways that you can help get back on top and make sure that your phone isn't creating more problems than it's fixing. Welcome back. Well, mobile phones, friend or foe? Well, the reality is they could be a bit of both. So when we look at how widespread the use of electronic devices has become in our society, it's really quite amazing how much we engage with electronic stuff. So the average Australian spends about 10 hours and 24 minutes, according to the Bean Crunchers at Ernst & Young, engaging with electronic devices of all kinds, computers, tablets, mobile phones. However, the most common is by far the mobile phone. 88% of Australians now carry one of these around with them in their pocket, which is amazing when you think about the fact that they've only been with us since, say, the early 2000s. And certainly as chiropractors, we're noticing an increase in what we refer to as text neck, as neck issues developing from the overuse or the incorrect use of electronic devices, to the point where now around 50% of the population is expected to experience neck pain at some stage during their lives. So what are some of the things that we can do to minimise the impact of our little mate, the mobile phone, creating problems for us throughout our lives? Well, one way is, first of all, to look at the way we're holding our phone. And one of the things I talk to my patients about is the idea of, instead of dropping your eyes to your phone, bring the phone up to your eyes. We want to engage with the screen in a way where we can keep our eyes level and not have our head dropping too far forward. Our head weighs about 5 kilograms, so as soon as it shifts forward off our center of gravity, it creates a huge amount of drag through the lower part of the spine, makes it a lot harder for the muscles of the upper back and shoulders to support your head in an upright position without creating strain on those structures. So, phone to the eyes, not eyes to the phone, would be tip number one. Number two would be take a break. You'd be amazed at how often you reach for your phone without even realising. About 30% of Australians check their phone within the first 2 minutes of waking up in the morning. So one good thing would be to set some boundaries around your phone use. So set yourself some goals of, okay, so I'm not going to check my phone for the first hour when I'm up and about in the morning. I'm going to go and do my breakfast and do my other stuff before I jump in and check my messages. Maybe commit to not looking at your phone during your commute in the morning. Basically, try and set yourself some boundaries around how often and when you engage with your device. And also, just on that, just maybe look at becoming more sociable with the way you use your phone. I know a lot of families place a ban on all devices at the dinner table. I know when I go out with my friends, for a drink or for a meal, I try very hard to try and keep my phone in my pocket and engage with the person in front of me rather than engaging with the screen. Okay, but what do we do if the problems have already arisen? Well, a lot of us, without even realising it, are starting to develop this forward posture coming from our use of devices. And it may not necessarily be causing you neck pain at the moment, but it might be starting to limit your function and mobility. So a little test that I find quite useful is, just while you're sitting or while you're standing, just try tilting your head back and looking up at the ceiling. Now, if you're doing this from a forward posture, what you're going to find is it's a lot more difficult to get your head into that upright position. So if doing that movement, looking straight up at the ceiling, creates any kind of pain or discomfort, or if it feels limited, you feel like you get to a certain point and then it just gets stuck because there's no movement in the joints, then that's maybe a sign that things have already started to creep forward. And that should be a sign that you don't want to ignore. So get in touch with your chiropractor to get that checked out properly. They may be able to help you with some corrective adjustments. They might be able to give you some exercises, some home advice to make sure that problem doesn't get any worse. And of course, obviously bring it back into an ideal position if there are some issues issues with the movement or the alignment. So there you go. So phones are useful. I love my mobile phone. I can't imagine life without it. But we need to use them smartly so our smartphone doesn't become more of a problem than a solution in our lives. Okay, so we'll be back again throughout May with some more tips on how Chiro can help. So until then, stay safe and we'll catch you all soon. Bye now.